Welcome to the Southwestern Illinois EMS System training on the dilution of atropine 1 milligram in 1 milliliter. The purpose of this training is to teach you how to create an atropine 1 milligram per 10 milliliter solution from an atropine 1 milligram in 1 milliliter vial and a 10 milliliter vial of normal saline. Upon completion of this July 2017 drug training, you will take a comprehensive exam on class marker, and you must pass the exam with a score of 80% or greater. Following successful completion of the exam, you should contact your company training officer to schedule the hands-on practical for epinephrine 1 to 1000 1 milligram in 1 milliliter dilution, atropine 1 milligram in 1 milliliter dilution, drawing sodium bicarbonate from a vial, and D10 administration. You will be utilizing the same skill sheets which are on the Southwestern Illinois EMS System website. The purpose of this training is to educate paramedics and PHRNs on how to make an atropine 1 milligram in 10 milliliter solution from a vial of atropine 1 milligram in 1 milliliter and a 10 milliliter vial of normal saline when the pre-filled atropine 1 milligram in 10 milliliter syringe is not available for use. Upon completion of this lesson, the paramedic and PHRN should be able to recognize conditions which warrant the administration of atropine 1 milligram in 10 milliliters. Recall the 6 rights of medication administration. Recall indications and contraindications for atropine administration. Demonstrate creating an atropine 1 milligram in 10 milliliter solution from an atropine 1 milligram in 1 milliliter vial and a 10 milliliter normal saline vial. Describe atropine dosing in symptomatic bradycardias. The paramedic and PHRN must always check the 6 rights of medication administration prior to administering any medication to a patient. The 6 rights of medication administration are right patient, right medication, right dose, right route, right time, right documentation, and reporting. Indications and contraindications of atropine. Atropine is indicated in symptomatic sinus bradycardia and in symptomatic second-degree AV block type 1. Contraindications to atropine are second-degree type 2 AV block and third-degree AV block. The reason that atropine typically does not work in these higher-degree AV blocks, second-degree type 2 and third-degree AV block, is that atropine works at the AV node, not at the fascicle bundle. General guidelines on the usage of vials. Careful attention to aseptic technique must be maintained. Always inspect vials for clarity of fluid, expiration dates, concentration, and correct medication or solution. Air should be injected into the vial as the vial is basically a vacuum-sealed space, so you need to replace the liquid with air. Determine the amount of air you will need and draw that amount of air into a syringe, then inject that amount of air into the vial and withdraw the medication or solution. Dilution of atropine utilizing saline vials. Follow aseptic technique throughout the procedure. Use alcohol pad to swab the rubber stopper on the normal saline vial. Utilize a 10 milliliter syringe and inject 1 milliliter of air into the 10 milliliter vial of normal saline. Then withdraw 1 milliliter of normal saline from the vial. This will leave you with 9 milliliters of normal saline in the vial. Remove the needle from the vial and eject the 1 milliliter of normal saline from the syringe. Use an alcohol pad to swab the rubber stopper on the atropine vial. Utilizing the same syringe, inject 1 milliliter of air into the atropine 1 milligram per 1 milliliter vial. Withdraw 1 milliliter of atropine 1 milligram in 1 milliliter from the vial and remove the needle from the vial. Use an alcohol pad to swab the rubber stopper on the normal saline vial. Inject the 1 milliliter of atropine into the vial containing the remaining 9 milliliters of normal saline. Next, you will gently agitate the vial to mix the atropine with the normal saline. At this point, you will now have an atropine concentration of 1 milligram in 10 milliliters. Utilizing the same syringe, inject 10 milliliters of air into the vial containing atropine 1 milligram in 10 milliliters. Next, withdraw the 10 milliliters of solution from the vial into the syringe. Administration of the diluted atropine solution. Aseptic technique should be maintained. Attach syringe to saline lock or IV tubing. Administer atropine 0.5 milligrams IV push or IO. Administer atropine solution for symptomatic bradycardia every 3 minutes as needed to a maximum of 3 milligrams. Be sure to follow each medication push with a saline flush. Monitor the patient's response to the medication. Note that epinephrine is used instead of atropine in pediatric bradycardias. This learning module is now complete.